Good afternoon, everyone, and very warm welcome to the opening session of this conference, Building Forward More Inclusively. We have, after the COVID-19 shakeup, the realities and opportunities for Africa's development partners. This is being organized by the Include Knowledge Platform in collaboration with the Ministry of Foreign Affairs, the Netherlands. Include, as you know, is our knowledge platform on inclusive development policies, which aims to promote knowledge on how to design and implement policies for more inclusive development that aim to reduce both poverty and inequality. My name is Isa Boud, and I'm the chair of the steering group of the Include platform and Include platform member. Now, why did we give the conference this title? The COVID-19 pandemic is the defining crisis of our time and has caused significant harm to national economies, livelihoods, and people's health and well-being globally, and in Africa specifically. As a result, up to 40 million people in sub-Saharan Africa are expected to be pushed back into extreme poverty, which means that extreme poverty is not only increasing, but is also deepening in Africa, especially in fragile states. Evidence shows that the pandemic has hit the poorest, women, and those with weak employment protection the hardest. There are some positive signs of resilience, like recovery of regional trade in East Africa and concerted efforts by national governments and donors to provide support to the African population and entrepreneurs, for instance, by providing social protection. However, it is clear that COVID-19 has and will further exacerbate existing inequalities. Therefore, the post-COVID-19 socioeconomic recovery response in Africa should address these inequalities and promote more inclusive development with urgency. For this reason, we specifically decided not to frame our conference on the Building Back Better narrative, as the building back may too easily suggest going back to the old normal. Rather, we are talking about building forward more inclusively. That requires us to address the root causes of inequality. Now there is a momentum to change the narrative and to promote fundamental, more structural, and inclusive socioeconomic transformation. For Include, the ambition of this conference is to provide a space for African and Dutch policymakers and practitioners to engage with African experts to learn about the impact of COVID-19 and help them find the best way to build forward more inclusively in Africa post-COVID-19. This opening session has as its objective to sketch current realities in Africa and opportunities for the continent's development partners after the COVID-19 shakeup. To this end, I would like to welcome all of you following the conference via the live stream and those of you present on the Zoom connection. That includes staff members of the ministry in The Hague, embassies, representatives of NGOs, research institutes, and the private sector. It also includes the Include platform and secretariat members from Africa and the Netherlands, and foremost, our speakers of today. I will mention their names here, all four, and then give the word to our first speaker. These include Kitty van der Heijden, Director General for International Cooperation of our Dutch Ministry of Foreign Affairs, Dr. Edward Brown, Senior Director, Research and Policy Engagements of the Africa Center for Economic Transformation. Then Stephen Collett, Ambassador of Business and Development of the Dutch Ministry of Foreign Affairs. And our keynote speaker, Jean-Paul Adam, Director, Technology, Climate Change and Natural Resource Management Division of the United Nations Economic Commission for Africa, UNECA. So, after these beginning words and a welcome, I would like to give the floor to Kitty van der Heijden, please, our Director General for International Cooperation. Please go ahead.
Thank you, Isa, and welcome to all of you participants. It's a real pity I can't see you, but I hope the audio and the visual will give you the feeling that we're here all in this room together to talk about something that is incredibly pressing, how we deal with COVID-19. That isn't just a health crisis, but Isa, as you said, it basically exacerbated existing vulnerabilities and inequalities and added a few new ones, particularly for young people and for women. And this multifaceted crisis that's currently unfolding in Africa requires us to really think and rethink how we deal with this as development practitioners. And so from my side, we're here also today, not just to look back, but to look ahead, to learn from what has happened, what's still happening in Africa. We may think that, in this country in Europe, Corona, we see the end of the end of the tunnel, the light is coming. Well, not so for many developing countries. I'm here to listen and to learn from many of you to identify what we can do together for a more sustainable and inclusive recovery, and to really join forces and bridge that gap, which I still see so often between research, policy, and practice, because I truly believe that only then we can tackle the challenges and transform these challenges into opportunities, and not just build back better, as you said, Isa, but to really build forward to a more inclusive and resilient economy. Because if we want to change course, this is the moment. We need to do it now. We've been standing at these crossroads for quite some time now. And as we sort of build and rebuild our economies, our societies, how do we resist that we fall into the trap of rebuilding those old structures that we know no longer serve us? And so for me, having been involved in sustainable development for about 3, almost 4 decades now, it's about the balance between the 3 E's, between the economy, equity, and environment. It's like a 3-legged chair. You grow your economy, you distribute the wealth of that growth equitable, and you grow without doing it at the expense of the natural environment on which we all depend. Now, if I look at the first E, the E for economy, what is it that I see as the biggest challenge and the biggest issue that we need to look at? For me, it is young people. It is youth in the perspective of a post-pandemic recovery. We know that Africa's growing young population represents probably its most promising resource, but many young people face incredible challenges accessing quality education, having decent work, having a livable income. And this, of course, has become even more difficult in the past few months due to the fallout of the pandemic. Not everyone has access, many do not have access to distance learning. They're the first ones to lose their job, last in, first out. It's always the young. And so how do we think of a post-pandemic Africa that invests and that seizes the opportunity to transform its economy, allowing a change that generates enough job for the millions of young people that arrive at the labor market each year? Now, the way we try to do that is a more integrated approach to sort of bridge that mismatch between the demand for quality job and the supply for skilled labor. Inclusiveness for us is the starting point, and we pay special attention to opportunities for decent work and income for young women. And the message for many of the young people that we work with, our collaborators, and this is a really important thing for us, nothing about us without us. We need to listen to young people. We need to involve them in shaping and implementing the policies that affect them, their lives, and their future. And so for us, we have just launched a youth advisory committee that I'm very excited about with young people from around the world, particularly in Africa. But in order to take this a step further, I would love to collaborate with the actual job creators, for which Include is also conducting highly relevant research. Second, the E for equity. That's the one that really drives me. And we have built on your excellent research carried out by Include in the past years. And one of the things that COVID-19 made me realize is that social protection and cash transfers really deserve a more prominent place in I would say, regular development cooperation. We know, and we have worked with cash transfers as part of humanitarian aid, but now with the learning sessions that we've organized together with you on social protection and cash transfers, we are learning that we have to change the way we work to address the most vulnerable with the aid that they really need. And then, of course, last but not least, the E for ecology or environment. And, you know, you cannot talk about eradicating poverty if we do not address climate change. And I don't know who of you had the time to read the 2020 Human Development Report with this lovely title, The Next Frontier, Human Development and the Anthropocene. And that report asserts, and I quote here, that humans have achieved incredible things, but we have taken Earth to the brink. This has come at the great cost of rising inequalities and poverty, and it puts our very survival at risk. But, and I quote again, it also says, we are the explorers, we are the innovators who get to decide what the first generation during the Anthropocene will be remembered for. Sustainability and inclusiveness, to me, go hand in hand. And I'm really curious to hear the perspective and hopefully future research of Include on this, because it's about targeted support to empower people to escape these complex, multidimensional locked-ins in marginal and fragile livelihoods. And what we do, well, we very consciously divest from any unsustainable energy system, and we focus very much on energy access. Now, a last few words, because I know I have my time limit, Isa, you were very dear. To ensure that our policies are built on the foundation of knowledge, we very much want to invest in those knowledge platforms such as Include. And to me, one of the key things that you do in Include is policy dialogues with African countries. I think that's your strength, and it acknowledges and really uses and draws in countries' agency to define their own development pathway. They know very well what they need, and we are there to help and support. And I think more often we could, as MFA, benefit from such dialogues in our work. After all, I mean, if anything, COVID-19 proved yet again that local communities are very capable of dealing with a crisis. They know what needs to be done. They only need some support from the outside. Let's not think that what comes from the West is best. Local communities should drive their own future. So let me conclude to say that I'm incredibly pleased that Include has organized this program. It's rich, it's wonderful. I know it will be very inspiring. I want to thank the participants for joining, and of course, a special thanks to Include for bringing us together. And I really hope for a fruitful learning journey, and I'll be alongside that journey for as long as I can today. Thank you very much, Isa, and all the others.
Thank you. Sorry. Thank you, Kitty, indeed, for these very inspiring words also. I think when you call the APDs our strengths, indeed, and they actually show that the West is not the best, because they have been set up by particular African members who have developed this pillar of our program in the past years, and we're very proud and indeed very happy to find that it's having such an impact. Then let me turn to Dr. Edward Brown, the Senior Director of Research and Policy Engagement of ASSET. Please, the floor is yours.
Thank you, Madam Chair. Excellencies, distinguished ladies and gentlemen, good afternoon and good morning, depending on the location. Madam Chair, it is my distinct honor and privilege to be here this afternoon to make the opening remarks for this all-important gathering of African and Dutch policymakers and experts to deliberate on and share experiences on the impact of COVID-19 on inequalities on the continent, and also to glean some actionable insights to build forward more inclusively in the post-COVID-19 Africa. For us at ASSET, this aligns with our vision of delivering economically transformed Africa within a generation. Madam Chair, let me take this opportunity to thank the Include platform, the Dutch government, for prioritizing this crucial stocktake to discuss and find solutions to the ongoing socioeconomic ramifications of COVID-19 pandemic. Let me start, Madam Chair, by providing just a brief overview of the COVID-19 situation in Africa as a precursor to the issue that I wanted to raise. First, when the first case of COVID in Africa was reported in Egypt on 14th February 2020, the continent, 24 countries, have recorded close to 5 million cases and about 131,000 people have lost their lives as of May this year, May 31st this year. After going through this relatively severe second wave of the pandemic in December 2020, countries like Nigeria, Kenya, and South Africa are already bracing themselves for the third wave of the COVID-19 epidemic. Global fatality rates have been declining, but according to the African CDC, between July 2020 and April this year, fatality rates in Africa has risen on average between 2.1% to 2.7%. And while new cases across the continent declined by 9% as of May this year, COVID-19 related deaths have risen by about 4%. And many African countries have launched now the immunization campaign. But as you already know, Africa is having less than 2% of immunized population. And the presence of new variants from India and South Africa in at least 20 African countries remain an imminent threat to the continent's survival. Now, what has been the impact? I guess we all know what the impact of the COVID-19 is. We agree that generally the impact on the healthcare has been relatively weak. It hasn't been, the continent seems to have weathered the pandemic relatively well in the health sector. But however, the economic fallout from the pandemic has been rather more devastating for African countries than for other parts of the world. Growth has been stifled, remittances have significantly plunged, and the debt situation remains a growing concern. The African Development Bank's report puts it that if African countries continue on this growth trajectory, between 34 to 50 million people could be pushed into extreme poverty by the end of this year. And of course, we all know gender inequalities have deepened, threatening the hard-won gains of women's full and equal participation in the economy, and has threatened the significant gains over the last decade in the attainment of the Sustainable Development Goals. Madam Chair, the pandemic has not only exposed the fundamental challenges of development in a weak institutional environment, but also the shortcomings of weak structures, misaligned policies, and leadership at all levels of governance. Madam Chair, notwithstanding, three interesting observations can be made from the experience of Africa in this pandemic. First is the health sector, which hitherto faced challenges of inadequate human resource and budgetary allocation, suddenly became top priority for all African countries during the many months of shutdown. Hopefully, the African governments now appreciate the fact that the health and the economy are interdependent. So that when the health sector is at risk, everything else is also at risk. The second observation is the lack of fiscal space to respond to and recover from the COVID-19. This has forced policymakers to think innovatively about all available options to finance development. Some of the leaders on the continent took decisive steps to mobilize resources internally. National COVID-19 solidarity funds were set up in many African countries. The expectation is that these gains made by the implementation of these innovative ideas could hopefully present opportunities for furthering domestic resource mobilization on the continent. The third lesson is that digitalization has become a high priority for many countries, and many government services transition during this period online, and governments have had to fall on digital channels to communicate with the people. 1 year on, the continent faces the possibility of an uneven and complex recovery process. Here, I would like to mention 4 critical issues which remain crucial in the inclusive and sustainable recovery of the continent. First is the leadership. The same level of commitment and swiftness with decision-making that characterized the early days of the pandemic will be crucial in facilitating the recovery of the continent and moving forward. This is not a time for COVID fatigue to set in. It will be important for the countries to continue to overcome the COVID fatigue and to continue to follow effective protective measures in order to curb contagion. The second issue is long-term transformational plans. We all know that the COVID emergency summarily derailed the implementation of many plans and swayed the priorities of governments from long-term to short-term needs. Notwithstanding, the pandemic highlighted the need to think long-term, build resilience and inclusive economies. Governments must therefore leverage the urgency of the COVID crisis to make meaningful policy changes, not only to help the short term, but also strengthen the long-term recovery efforts. It is essential that long-term transformational plans are prioritized and more diversification, more export competitiveness, and more productivity increases, as well as upgrading of human capital, and more importantly, to improve human well-being. In short, as Asset says, African countries must grow with depth. This is the definition of economic transformation that Asset is trying to, to push. The third is the financial resources. For governments, we know that the recovery would require a lot more resources. But even more important is the political commitment to the issues and looking more internally to deliver results. But at the same time, it is clear that domestic resource mobilization would not be enough to mitigate the impact of the COVID-19 on the continent. And the G20 debt service suspension initiative and the common framework for debt relief treatment, while commendable, must be improved to attract private capital, as well as allow for more participation of vulnerable developing countries like the lower middle income countries on the continent, who are forced to tap into international capital markets for development of funds. Additionally, the special drawing rights by the IMF must be extended to all developing countries, especially the middle income countries. And fourth, of course, is vaccines. It is lamentable that Africa is seriously lagging in vaccination because of limited vaccines available to the continent. This is an issue that requires immediate attention. Madam Chair, let me quickly, before I end, permit me to make a few observations on innovations and post-COVID recovery moving forward on economic transformation. Digitalization and innovation lie at the heart of the recovery and to move forward. Digital technologies are emerging as an important pathway to mitigate economic losses from the pandemic and to innovate across countries. But we also know that the innovation ecosystem in Africa is nascent. Most innovators are limited by fundamental challenges in financing, governance, regulatory structures, and access to inputs, business support, mentorship, skills, and digital infrastructure. Governments should therefore collaborate with ecosystem stakeholders at both national and regional level to dismantle regulatory bottlenecks and to co-create policies and programs that promote a conducive ecosystem for innovation. Leveraging the African Continental Free Trade Area Agreement and other initiatives, governments should build regional and continental partnerships to develop large-scale digital infrastructure and harmonize policies, approaches that stimulate innovation. Madam Chair, let me end by wishing everyone a fruitful deliberation over the next several days of the conference. Thank you very much.
Thank you very much indeed for your very interesting contributions to this discussion. that I'm sure that we were going to come back to a great deal, especially in terms of the impacts of the COVID, but also the challenges and the pathways that you've shown around digitalization, innovation, and reduction of barriers as a means to build forward more inclusively. Let me then give the word to our keynote speaker, Jean-Paul Adam, Director of Technology, Climate Change, and Natural Resource Management at UNECA. Please, the floor is yours.
Thank you very much, Madam Chair. And I will be just sharing a presentation which will guide the remarks that I'll be making. And I would like to, first of all, express our appreciation to the Include team for involving the Economic Commission for Africa in this event, which I think has a great important role in terms of defining some of the way forward for Africa, but also how Africa's partners can engage with African countries in a way which is meaningful and in a way which makes a difference in terms of the results that we hope to achieve. I bring, first of all, the greetings from Dr. Vera Songwe, the Executive Secretary from the Economic Commission for Africa, and she regrets that she could not be here personally. But I hope that the remarks that I will make will speak to some of the priorities that ECA is putting forward with its partners. And a lot of the ideas that we are presenting today can be found in a report that we have issued a few months ago called Building Forward for an African Green Recovery. And the web link is on the screen, but you can also find it by typing into Google or going onto the UN ECA main webpage, and it is right there at the bottom of the page. One of the key messages that we've underlined as part of this report is the importance of addressing development through the lens of the current emergencies. And the COVID emergency is only one of two major emergencies, which is, of course, the climate emergency. And both of these elements have a very dramatic impact on the economies of African countries. And no issue better illustrates the vulnerability of African countries and also the challenges in terms of achieving sustainable development than the current access to vaccines. The challenges going forward are that in terms of sustainable development, we risk having an even greater divide in terms of access to healthcare, in terms of access to education, and in terms of access to sustainable economic development. As we can see from this slide, vaccines have been rolled out very successfully in large parts of the world, including in parts of the developing world, including, for example, Asia. But Africa is at a very, very low level. And this slide is from February, and unfortunately I couldn't update it because our graphics department only provides this updated slide every quarter. But as was already mentioned by Dr. Brown, Africa's vaccination rate still remains 2%. So we anticipate that even in terms of the new graphic, the color coding doesn't change, unfortunately. Climate change has an impact which is as dramatic and in the long term will be even more dramatic than COVID-19. The contractions from COVID-19 were initially, as an average, 2.7% in terms of the impact on GDP. In some countries, obviously, it was much more severe, but as an average, Africa was quite resilient relative perhaps to some other parts of the world. But the problem is the long-term nature of the crisis. Climate change is already costing African countries on average around 5%, and African countries will lose at least between 2 to 5% of GDP based on low levels of warming, meaning of about 2 degrees. If you go to higher levels of warming, then the loss of GDP accelerates. And it is also more impactful in certain regions than others. And if we can look on this graphic, the region of Northern Africa and the Sahel in particular, by 2030 could lose up to 15% of GDP to climate change. So addressing climate and COVID simultaneously are part of a new development agenda. And addressing climate change and COVID in Africa is and should be the major development agenda. Unfortunately, Africa was not on track to meet the SDGs even before the onset of COVID-19. And that's because we were trying to fund the improvements essentially through commodities and extractives-based exports-driven growth. And the level of growth, while relatively good compared to the rest of the world, just of in excess of 3% before the pandemic, would not have provided the right level of growth to be able to achieve the transformative level of investment that is needed to achieve the SDGs. And as we can see, while there has been some progress, we are off track in all of the SDGs except for SDG 14, life below water. And even that is slightly deceptive because a lot of the progress has been around, for example, the strategic frameworks that have been established, such as the African Union Blue Economy Strategy and such as marine spatial plans in a number of African countries, which is a big improvement to where we were. But in terms of practical investments, we still have a long way to go. One of the key elements that we have been advocating in the report is the need for quick and immediate financing. The studies that we have done have shown that if we had managed to invest quicker in 2020, we would have actually avoided a recession. The first line, which is in orange, indicates that if we had managed to get the stimulus much sooner, we would have avoided going into negative growth for the average African countries, and the rebound would have been smoother. The other two, all of these three lines I should highlight are hypothetical, and it is based on when stimulus would be applied to an economy. And the level of growth obviously is higher when the stimulus is applied later, but in terms of the absolute growth level, it remains below what would have been achieved before. This is also in a context where Africa was not growing at a satisfactory rate even before, and we will address that a little bit later on. The other key point I would like to emphasize from this slide is that, again, there is a big disconnect between funding, which is committed, and then the actual disbursement. And in 2020, $56 billion in various forms of assistance, whether it be through IDA, in some cases through debt relief through DSSI, and other forms, including grants. The total pledge was $56 billion, but only $35 billion was actually disbursed by the end of 2020. There's been some progress since then, but we always see that there is a challenge in terms of the availability of financing to deal with issues quickly. So in terms of the work that the ECA has done in identifying the areas where we could have the most impact in terms of stimulating a green recovery, we have worked on a series of case studies. And I will touch on 4 of these case studies in today's presentation. But firstly is to highlight the challenges that African countries have to mobilize the levels of stimulus that would be required to achieve a level of change that is needed to get back on track with the SDGs. And so we are contrasting the levels of stimulus that have been implemented by certain African countries, and there are 3 listed here, which are Egypt, South Africa, and Kenya, relative to, for example, a few OECD countries and a few other emerging economies such as India, and of course, developing countries such as China. And if we look at the overall level of stimulus, we can see that the UK, for example, had about 12 to 13% of GDP in terms of its stimulus. Australia, almost 10%. And a portion of this stimulus was green, but as you can see, a very, very small portion. Whereas in Africa, the highest level of stimulus was put in place by Egypt, but that was still at only 0.4% of GDP, while South Africa was at 0.1% of GDP, and Kenya was at below 1% of GDP. And while portions of African spending were also green, because the overall level of spending has been so low, it has been negligible. And the problem is the lack of financing for Africa has meant that funding has essentially been focused on rescuing existing industries rather than investing in new areas that can be transformative. Now, what we have done is looked at, if we were to hypothetically invest in sectors in various African economies, what would be the impact if we were to invest in green sectors? And there are various definitions for green sectors, which actually are looked at differently in different countries because some sectors have a bigger impact in some countries than others. And we compare those to what we'll call traditional sectors, which are essentially sectors that are dependent on fossil fuel-based energy generation, or which create a very large carbon footprint. So if you're looking at agriculture, for example, it'd be comparing a green agriculture, which is based on climate smart solutions, as opposed to intensive agriculture, which is dependent on fossil fuels. And fossil fuel-based fertilizers. So what we saw was that in a country like South Africa, which is perhaps the most industrialized among African countries, by investing in energy, in nature-based solutions, and in climate-smart agriculture, you achieved 250% more jobs in the short term, and you added 420% more value addition throughout the economy by investing in green sectors as opposed to fossil fuel dependent sectors. In DRC, the situation was slightly less pronounced, but that is also because of the nature of the economy, where you have to create large amounts of employment, and in some cases, unfortunately, relating to low value jobs. But 130% more jobs were created still in the short term by investing in the same green sectors, and 280% more value addition throughout the economy. In Kenya, 120% more jobs were created in the short term and 200% more value addition, while in Egypt, there were 55% more jobs in the short term and 150% more value addition in the wider economy. So some of the sectors that had the most impact in the various countries, if we look at South Africa, it was renewable energy, investment in low emissions transport. And in the case of South Africa, the opportunity there is in particular in relation to not only establishing, for example, public transport on the basis of electric vehicles, but also on manufacturing it themselves. And natural capital investments around parks and around protected areas, and also about practicing climate smart agriculture featured highly in terms of the impact in terms of jobs as well as value addition. In the Democratic Republic of Congo, utility scale renewable energy was a priority alongside mini grids and micro grids, recognizing that you would not be able to achieve energy access to the level required using only one of those strategies. And natural capital investments were also extremely impactful. In Egypt, renewable energy was the highest impacting, followed very closely by low emissions transport and investment in natural capital investments, which include parks and also climate smart agriculture. In Egypt, agriculture and sustainable water solutions were the priorities and which brought the most impact. And in particular, using solar energy for desalination brought positive impacts in terms of agriculture, as well as wider impacts on society. Renewable energy and investments in utility scales and in transmission are the other areas. And Egypt is notable in that some of the investments they have done already, such as a green bond issued at the end of 2020, have already been aiming at this kind of investment. And clean transport solutions, by investing further in public transport solutions using electric vehicles, were also scoring very highly in terms of their impact relative to fossil fuel investments. So in terms of the reset that we want to see to transform Africa's development, where do we invest to maximize recovery and resilience? Firstly, in terms of sustainable infrastructure, and if you go into our report, you'll see a number of areas which include digitalization, but energy is really the platform which allows the investments in all other sectors to take place. And so for the purposes of today's presentation, we're focusing only on three areas. The first one being energy, with a $500 billion opportunity available in Africa by 2030 in terms of investing to achieve universal access to electricity, recognizing that almost 600 million Africans currently do not have access to electricity. It's unfortunately not always understood that Africa has already invested very significantly in renewables, but principally around hydro resources, with about a quarter of energy generation currently being done through hydro. But this has had a huge impact in relation to climate change, where droughts have affected the availability of electricity. And this is something which was demonstrated in Lake Kariba in Southern Africa in 2019 and 2020. There is also a need for strong baseload generation in Africa to address the issue of increased share of variable renewables. And gas may be a key part of this transition, but we stress that it is a transition and it is not a long-term solution. There are 22,000 megawatts of clean energy already established in African nationally determined contributions. And we should note as well that out of the continental projects that are identified as priority under the African Union Infrastructure Priority Projects, the PIDA, 18 out of 19 are actually renewable energy projects. and only 1 is based on fossil fuels. There is also realistic potential to increase the installed capacity by adding between 110 gigawatts and 200 gigawatts of renewable power by 2030. And the key element is the financing and the need to de-risk, in particular, private sector investments, which can completely change the dynamic for investment in renewables in Africa. And this slide is to illustrate that there is huge ambition in Africa already, with 39,000 megawatts of investments in renewables already announced. The other aspect in terms of solutions are investing in climate smart agriculture to address the issue of food security. And this should be focused around crop diversification, also around addressing inclusive market access, also about using renewable energy sources to ensure access for both large food producers as well as SMEs and smallholders, as well as the importance of addressing the reducing of emissions from farm practices through more efficiencies. Nature-based solutions are also an element which have been identified as a priority because of the big impact that the current rates of growth and the current economic strategies are having on Africa's nature, which is the basis, in fact, of its wealth creation in the first place. Africa, unfortunately, has the highest rate of loss of forest cover in 2020, according to the FAO, with over 3.9 million hectares of forest cover lost over the last decade. Africa's overall forest cover still remains very good, but the rate of loss is concerning. And unless we can adopt strategies and economic activities that create livelihoods, but also enhance nature, then we will be faced with an ecological catastrophe. Agriculture is very important for nature-based solutions where agroforestry can be supported and building value chains using the AFCFTA and supporting rural communities. The importance of protecting carbon sinks is also critical, and notably the Congo Basin is the second largest carbon sink, naturally occurring carbon sink in the world after the Amazon. And the Congo Basin on its own can sequester 3 years worth of the world's emissions. So protecting these areas and creating livelihoods around that protection is going to be critical. Safeguarding water supplies is also important, and tree planting has a key role to play in that regard, and also the creation of jobs by undertaking such activities and around safeguarding future water supplies. The protection of oceans is also a critical element, with the goal of having 30% of oceanic spaces under protection by 2030 under the Convention on Biological Diversity. African countries have made progress as well in moving forward on using marine spatial planning to better identify economic activities that can take place in the oceanic spaces. So the concluding part of the presentation is to really talk about the shakeup that is needed in terms of development finance. And we'll focus on a few key areas. First and foremost, we do have to flag that the promise of 100 billion per year needs to be delivered, because climate change response in Africa and building resilience is about development. It's about providing access to water, it's about providing access to services, and it's about addressing poverty in all of its forms. Some of the financing towards addressing climate change can be achieved through a global price on carbon. And this is one of the key priorities that we hope will emerge from COP26. And this is something which, while in Africa by no means is without controversy, because some countries would be concerned about it, overall Africa can gain through an appropriately globally implemented carbon price. Most reports recommend a floor of carbon price at least $50 per ton, but many scientists also recommend a higher price. But just to illustrate through this graph, you can see that with a carbon price at $50 per ton, Africa, in just 3 sectors, by investing in clean cooking solutions, in increasing energy, renewable energy by 22%, and investments in climate smart agriculture and agroforestry, could raise up to $30 billion per annum, which can be invested throughout the economy. It can be invested back into climate resilient solutions, or it can address the sourcing of vaccines, for example, or other health priorities or education priorities. Africa can also deliver its green recovery with the right support, and the key is to provide investment early. COVID-19 continues to have an impact on the economies of African countries, And climate change is also costing countries on average around 5% per year. Delaying stimulus costs from 2020 to 2021 cost Africa 5.4 percentage points in lost growth. And as we've said earlier, that meant that if we had implemented a stimulus of, let's say, around 100 billion in 2020, we would have averted a recession totally. And the problem going forward is that Africa still does not have access to the resources required to be able to do this investment itself. Therefore, the need to generate these investments externally. We highlight here some of the key areas that could be addressed. Firstly, the 100 billion commitment under Paris. Secondly, a liquidity and sustainability facility, which is essentially a way of de-risking private sector investments into key sectors such as energy. And this is a proposal that the Economic Commission for Africa has put forward, asking that SDRs be used as a means of crowding in the private sector and reducing the risk of financing into these sectors. Green and blue bonds, which are essentially a form of blended market-based finance, are something that can be developed with the multilateral development banks. And notably, the World Bank and the IMF are exploring these options to bring in more investment into these sectors. And finally, debt for adaptation or debt for SDG swaps are also an opportunity to address Africa's debt overhang, whereby existing debt could be repurposed and the savings be invested in sectors that contribute towards achieving the Sustainable Development Goals or achieving climate resilience. So this is a summary of some of the key areas that we have addressed in our Green Recovery Report. And the key message is to invest early, to have upfront investment, which allows essentially a new Green Deal for Africa to really take shape. Unfortunately, Africa does not have enough of these resources itself and needs support to be able to generate that level of investment. We could look at it as Africa's Marshall Plan, in a sense. Thank you very much.
Thank you very much indeed for this very succinct but very clear way of setting out what the challenges are and what the experiences are of the African continent up till now. It's very complex, so I hope that we will be able to tap into your presentation as well so that we can go through it in more detail ourselves. That brings me to the possibility maybe of one or two questions. There is one clarifying question to you, Jean-Paul. Would it be okay if we allow you to do that bilaterally on the Slido? Because I think in the interest of time, I would like to go to our next speaker, Stephen Collett, the Ambassador of Business and Administration of the Dutch Ministry of Foreign Affairs. Please, the floor is yours.
Thank you very much, Professor Bout. And it's so wonderful to be here amidst smart heads and warm hearts. And that's what we require in this current world and the stage we are into. And just allow me a few reflections. I mean, the big realization of our time, if I may, is that we are in this together. So that's why it's so essential to have Include as a platform bringing us together around evidence, because we need to know what is effective cooperation, because we have scarce means, a little time, and we need to invest rightly. Now, this is about the what and also about the how. And I would like to reflect very briefly on a few points made by Jean-Paul Adam. Thank you so much for your introduction and clarifying that we are facing multiple crises, which are actually interacting, right? Climate, COVID, they're interacting. You underline the need for green recovery, and you make the case and you demonstrate with your evidence, thank you for that, that this can create jobs and growth. That's important. Now, my question and my reflection for today would be, how can we make these inclusive? This means, how can we secure that these jobs and this growth also includes the poor segments of the population? And this, I think, links us to what Edward Brown mentioned on innovation, the importance of innovation for the investments we are going to make. Because if we want to make all those investments which we require, as been underlined by Jean-Paul Adam, we require private investments as well. We require bankability, because that is a prerequisite, as we all know nowadays, to attract investment. Now, then for inclusion, it means that we need to ask ourselves, how do we make the poor, those who are left behind, those who do not have access, how do we make them bankable to secure that these green jobs are also their jobs? And for that, we need to think innovative. And one of the suggestions I want to leave you with is the suggestion that we then need aggregators. As there are so many people with smaller jobs in the informal economies who need to become bankable if we want to invest into them and their potential to contribute to green and inclusive growth. So for that, we need aggregators such as cooperatives, which can help us bring together into a sizable body, if you like, all those small entrepreneurs and job seekers into a bankable proposition. And the big plus of that is that we also then allow for participation. Because as Kitty van der Heijden said, nothing about us without us, right? So then we can bring all those together who can then design the future of their inclusive green growth. I would like to leave you there with that thought. And thank you so much, Jean-Paul Adam, for your setting out the scene on the relevance of green and inclusive growth and recovery today. Thank you so much.
Thank you so much for that very interesting question that you're leaving us with for the coming sessions. I'll turn now to Dr. Edward Brown to give a very short reflection on the introduction.
Thank you so much, Madam Chair. I would just like to make a few observations. I think John-Paul Adams has really laid out some of the strategic issues that needs to be undertaken in order to move forward post-COVID. It's fundamental in terms of financing. It's also, oh, sorry, I didn't bring my video on. And it's also very much critical in terms of moving forward. Just to complement what John-Paul Adams have just indicated, I think the whole issue of green recovery and smart agriculture and so on are very important. One of the things that we at ASSET are trying to undertake, and in fact, in our next African Transformation report, which is our flagship report that comes out twice, every 2 to 3 years. This year, it's coming out in July, this year, and it's focusing on integrating to transform. This is basically interrogating the current trajectory of African transformation in Africa. And the study, our analysis have shown that the African economies are not transforming at all. And in fact, they are stagnating. Transformation has stalled over the last couple of decades. Now, the part of the challenge has been that the African countries are working in isolation and they are not working together. This is a fundamental issue, and that is why the African Free Trade Area Agreement is critical in terms of driving the political impetus for integration. And we have identified, at least as part of the integration process, that there are 4 key elements or 4 thematic areas that needs to be identified. And I think John-Paul Adams has mentioned quite a few of them. Is the climate issue. Of course, the COVID has set back a little bit, but definitely there is the opportunity to move forward. But more importantly, there are 3 key issues also that we're looking at beyond the climate risk and so on that John-Paul Adams has clearly articulated, is the whole issue, as I mentioned earlier, of digitalization and innovation. And also, more importantly, is the whole issue of demographics, jobs. How do we continue to provide jobs for the growing and burgeoning youth population in Africa? And we are making the case that for African economies to transform, they need to integrate. They need to collaborate with each other. I think the issues that John-Paul Adams was mentioning about the riparian issues of carbon sink in the Congo river basin are critical. But these are riparian issues that can only be addressed through regional cooperation. Bringing the countries that are subsidiary to this issue together to think about how effectively to address those issues, because there are clearly benefits and also spillover effects that can occur. So what we're trying to do here is saying that it is important for African countries to transform, but to transform, they need to integrate. And that some of the key drivers of these are to focus on the regional public goods. We're talking about the whole issue of the transport corridor. We're talking about the issues of digital connectivity, which is very important. We see about 15 African countries are landlocked, and they're not capable of really, lifting themselves out of poverty. So the need to come together is going to be critical. So to complement what John Paul Adams just mentioned, I just wanted to bring out this issue. And as a precursor to the issues that I just mentioned, we are going to be, launching the African Transformation Report on 15th of July, and we would like everyone in this platform and this meeting to also, hook into that process. It will be announced shortly. Thank you.
Thank you indeed. I see that we are actually going into our last 3 minutes. So what I'm going to do is say that what we've learned from our speakers is, one, that we need an integrated approach, balancing economy, equity, and climate change issues, as Kitty van der Heijden told us. And in fact, all our subsequent speakers have reflected precisely on those balances of those different challenges that we face, talking about jobs for youth and for women, in stressing the importance of digitalization and innovation, the green recovery solutions and the spending that is the stimulus spending that is necessary to generate that, and finally, the more governance-related issues of increasing cooperation between African countries. I will just leave it there as issues that we are going to come back to in the coming days, because we have a very interesting program which is going to reflect on these areas. This opening session was already very inspiring to set the stage for the next 2 weeks. But I would like to invite you to join the other sessions as well. Directly after this session, we're going to have a session on the theme of youth employment, and that will be followed on inequalities. And later that week, we're going to talk about perspectives on decent employment for Africa's youth, and particularly then zoom in on Uganda as a case in point. Then next week, we're going to have a donor will meet a policymaker session to discuss how to model social protection responses on the continent. And finally, on Wednesday, we're going to close the conference by first putting the spotlight on Include's flagship African policy dialogues and their approaches and strategies during the COVID-19 period and currently. And we will close the conference with an inspirational keynote speech by Mavis Owozi-Gyamfi, the Executive Vice President of ASSET, who will look ahead for Africa's recovery post-COVID-19 and highlight the role of innovation in the process. The moderators of our youth employment panels will also share their perspectives on the future of Africa from their own point of view. For us at Include, we very much hope that this conference will provide space for African and Dutch policymakers and practitioners to engage with African experts to learn about the impact of COVID-19 and together discuss the best ways to build forward more inclusively in Africa post-COVID-19. Thank you very much indeed.
Thank you very much, Isa. I will now take over and welcome everyone to our COVID-19 session. So today we are going to talk about equity in COVID-19. My name is Annika Altaf, and I've been managing the COVID-19 research program at Include. And before we start our session, I would like to share our house rules with you. Please kindly mute yourself to limit the background noises and not to interrupt the flow of the speakers. Please do not unmute unless the moderator gives you the floor. Also, this session will be held in English, but we have French translation. If you would like to hear our speakers in French, please click on interpretation in the bar below in meeting controls, and you can set the language there. During our meeting, we'll be taking screenshots. So if you do not wish to be included, please turn off your camera. And lastly, we will be using Slido for audience interaction and to take your questions. You can access Slido on your computer or via your phone. And how that exactly works will be shared in the chat. So please do log on to Slido so we can have you involved in our discussion. So once again, thank you all for joining us today and to hear more about our research program called Equity in COVID-19. We have quite a full program today, and so I will very briefly tell you what this program is about, and then we'll get right into it. Our program was initiated almost a year ago in order to discover the implications of the pandemic on inequalities and to see how governments of 12 African countries dealt with equity in the development of COVID policies and measures. So today, the researchers involved in this program will be sharing their findings with you, both the evident findings, but also the more surprising or unexpected findings. And we will start the session with a synthesis of the country case studies. After that, we will break into two groups to, on the one hand, hear more about the challenges around inclusivity, and on the other hand, to hear about the innovations and solutions that were found by the researchers. We will end with a short discussion with policymakers from both the Netherlands and Africa to find out how this program can feed policy, both in COVID, but also post-COVID times. So without further ado, I'm very happy to give the floor to Professor Tsotsi Tsigata. She is the director of the Institute of African Studies at the University of Ghana. Together with Dzifa Tofike, she conducted the synthesis. So Tsotsi, please go ahead. Tsotsi?
Can you hear me now?
Yeah.
Sorry, I was muted. Thank you so much, Annika, for introducing this session. And thank you all for coming to engage with the synthesis work and the country work that the teams have been doing. Our presentation basically is slides of our synthesis report, and we've titled it Africa's COVID Responses, Proactivity, Hits, Misses, and Deepening Inequalities. Basically, what we've heard already this morning raises several of these issues that we have found in the synthesis reports. To recap, the reports come from the study of, the report is reporting on the study of 12 African countries, looking at their COVID experiences. It's Benin, it's Burkina Faso, Ethiopia, Ghana, Mali, Ghana, Kenya, Mali, Mozambique, Niger, Nigeria, Rwanda, and Tunisia and Uganda. Basically, all these studies have looked in different degrees and with different methods at the implications of COVID, but also state responses, looking particularly at questions of livelihood and structural inequalities. This presentation basically is looking at the findings under the following headings. One is the importance of context and pre-existing conditions. Two, the issue of commonalities and specificities of COVID responses. Three, the implications of severity of containment measures. Four, the implications of responses for inequalities. Five, the challenges of population data, participation, and democratic deficits. And lastly, what we still do not know about the future arc of COVID-19. Before I go into these, I just want to summarize what the findings tell us, so that if I run out of time, you'd have heard all of these. The first point is that country context and underlying socioeconomic and political conditions have been critical in shaping COVID responses by both government and civil society. That's one. 2 and 3 are connected. 2 is that uniformity of containment and mitigation measures are raising questions about whether country specificities and the views of citizens have been sufficiently considered in COVID responses. Related to this, we also find that the appearance of uniformity notwithstanding, the sum of measures in each country differs in terms of the combination of measures, the target populations, the budgets, the intensity of implementation, the levels of compliance, and who in those countries are considered most badly affected and therefore in need of measures. Our fourth finding has been that the severity of containment measures have been critiqued as over the top, in some cases involving human rights abuses, and in other cases creating existential crisis for the poor and the not so poor. The next point is that both containment and mitigation measures are deepening inequalities or creating new forms of inequalities because of faulty targeting, the exclusion of certain categories of persons, but most importantly, because of the short-term focus of measures and the fact that measures did not take pre-existing structural inequalities in mind. Another common finding has been that the lack of population data, participation deficits, and patronage have been a challenge to government responses to COVID-19. And last but not least, that there's a lot we still have to learn about the future arc of COVID-19. So to the first finding about country context, our pre-existing, our country context findings basically highlighted the pre-existing socioeconomic and political conditions and showed that these were very important in COVID-19 responses. At the same time, they also highlighted particular economic and political stresses. And if we look at some of those conditions, we find that 7 out of 12 of our countries were low-income countries. Many of them were primary commodity dependent countries, suffering agrarian stagnation. In almost all countries except one, there was a dominance of the informal economy and informal work. We also found that in all countries, there were already increasing intersecting inequalities of income between the formal and informal economy, between agriculture and non-agricultural work, and that much of informal work had been found to be precarious and basically creating poverty. Also, there were already existing inequalities in gender and also spatial inequalities, urban, rural inequalities, regional inequalities, and last but not the least, inequalities around disability. And these are all inequalities that interest the Include platform. Another finding about the pre-existing situation has been that there's this global trend of retreat of democracy and rise in populist nationalism, and that Africa has not been immune from that. Given these situations, several reports talked about COVID as a crisis within a crisis, and attention was drawn to Islamic insurgencies in Mali, Mozambique, Niger, and Nigeria, ethnic and political tensions in Ethiopia, terrorism and police brutality, Kenya, Nigeria, Uganda, and last but not least, economic instability and repression in Benin, Ethiopia, Ghana, and Uganda. In terms of COVID responses, what became very clear looking at the country studies was that there were many commonalities in measures, but also some specificities. And the uniformity of these responses established the influence of WHO and the Africa CDC on country responses. If you look at containment measures, they were mostly social distancing and bans on large gatherings, use of face masks, frequent hand washing and use of sanitizer advisories, full and partial lockdowns, school closures, border closures. But even, and then if you look at the support measures, they were in 4 main areas: access to essential services, so water and electricity subsidies, remote teaching, expansion of health, social safety nets, the usual cash transfers, and a few countries doing prison pardons, and several countries doing food security programs. Then there was income protection, reduction in taxation, ease of loan repayment conditions, and fourthly, business support, so stimulus packages for businesses, loan, debt, and tax support. And what's important to note is that although all these measures were common, there were variations in intensity and scope and in the implementation of measures. In addition, there were some uncommon support measures. So there was transitory housing for certain disadvantaged groups that had been caught up in lockdown in Ethiopia. There was the reunification of street children and integration of returned migrants with families in Ethiopia, programs for rural agricultural economies in Mali, worker protection programs in Ethiopia and Tunisia, and lastly, political class salary renunciation and reductions in Kenya and Burkina Faso. So the third finding about the severity of containment measures basically found that they were economically damaging and at the same time were not proven to have a bearing on the disease burden. Obviously, there are data challenges in African research, but this was a general impression. And we've tried to classify countries in terms of the nature of their COVID containment measures, whether they've been mild, mainly one measure, or drastic, 2 or more measures, or medium. And in cases where containment measures were found to be drastic, several reports talked about the fact that they were draconian legislation with long-term implications. Sometimes it was the length of lockdowns and curfews, school closures, and also land border closures. Those were the particular measures that were felt to be over the top in certain cases. There were also reports of containment and measures resulting in human rights abuses. And most importantly, that they mainly created existential crisis for particular social groups and workers, and also brought people who were not poor already back into the poverty fold. And I think this is something that has been discussed in the opening speeches that we had this morning. And the main point here being that there was no evidence that the severity of measures had an impact on infection rates and disease burdens if you compare various countries. The fourth point, which has to do with the implication of resources for inequalities, is particularly telling and important. The studies showed a clear urban and formal economy bias in access to COVID support, whereas most of the job losses and the disruptions of livelihoods had been mainly felt in the informal economy. They also found that mitigation and support measures were generally short-term and did not address existing structural inequalities. And most importantly, have proved very difficult to sustain because of budgetary issues and the fact that many countries do not have the reserves and the wherewithal to maintain these measures. Also observable was a segmentation of measures and beneficiaries. So The poor mainly received food and cash transfers. Utility and income support mainly went to formal workers and households or workers in the formal economy, and business support mainly went to formal businesses. Related to this, universal programs or programs that were touted as universal, such as water and electricity subsidies, because they required an availability of and access to amenities, did not turn out to be universal, because many people could not even access the amenities, how much less basically access the subsidies. It was also found that business support measures depended on the level of formalization of businesses, and many of the measures which were targeted at the poor, particularly the cash transfers, relied on already existing limited programs, and many of these programs have now not been able to capture the new poor that many studies have identified. The fifth point has to do with COVID response challenges. Across the board, there was reference to this problem of a lack of robust population data to inform targeting. Some countries definitely had stronger measures, and some were even improving their data gathering. So Rwanda and Nigeria are good examples of these trends. On the other hand, again, across the board, it was found that transparency and citizen participation deficits were very huge in the crafting of responses. And this had to do with the fact that many responses were seen as emergency responses, and there appeared to be no time to consult and address the views of populations. Even in the countries that had robust data, questions have been raised about the dangers of patronage and abuse in the identification of people who were eligible for responses. So what are some of the knowledge deficits and uncertainties of COVID that were uncovered in looking at our 12 studies? One of them is that given the time when the studies were conducted, we do not have any information about the implications of the third wave and what it's going to do. And we have indications. Only yesterday, it was in the news that several countries in Africa are already beginning to experience this third wave. Another issue of knowledge deficits has to do with an issue of attribution and measurement of COVID measures. Already country reports have been very nuanced and sensitive in drawing attention to the fact that there were pre-existing conditions that had been exacerbated by some of the effects of COVID and COVID responses. But this is an area of research that needs a bit more care and attention. We also have not been able to establish clearly which COVID-related changes are temporary and which are going to be more permanent. We also were not able to answer sufficiently the question of the fundamental changes and restructuring of economies and societies that would be required to address the issues that have been exacerbated by COVID. So the stresses on economies, the increasing inequalities, the stagnation of progress in certain areas that have been uncovered. Another thing which many studies did not pay attention to because of probably the research questions has to do with which segments and sectors of African societies and economies have had a good COVID pandemic, in the sense that who have been benefiting from COVID, and therefore what positive and negative lessons can we draw from the experiences for the future. An issue which also did not receive a lot of discussion in the research is about vaccination nationalism, vaccination hesitancy, Africa's lack of resources and infrastructure for vaccinations. These raise questions about Africa's ability to vaccinate a critical mass of its population. And how should African governments respond to these issues and this lack of capacity? And a question which also is left on the table is that what would several years of a pandemic mean for Africa as a whole, but also for African civil society? Because we see what studies have referred to as some promising trends communal action, solidarity, domestic resource mobilization, self-improvement, and even activism in civil society. At the same time, we know that societies are very stressed, and some of them are at breaking point in trying to cope with COVID on their own without adequate state support. So it will be interesting to find out, or to begin to turn our minds to what several years of a pandemic could mean for this aspect of African civil society. I think in sum, what we are left with is basically the need for a second generation of studies that will come to grips with the medium and long-term implications of COVID-19 in Africa. So I rest this case, and Jifa, Tovike, and I thank you for listening.
Thank you very much, Tsotsi, for this very interesting presentation. I would like to take a few questions now, if there are any. And I see one has come in the chat from Marius de Jong, who is asking what has been learned from earlier epidemics in Africa, Ebola or HIV, the role of CDC Nigeria in West Africa. Tsotsi, can you say anything about that?
Briefly, and hopefully Jifa will also add her reflections. In fact, some of the reports did talk about this issue of learnings from earlier pandemics, and particularly the question of Ebola. And in fact, they were suggesting that one of the reasons why African countries could be very proactive in responding to COVID. The fact that they immediately went into full gear and started putting in place measures had to do with this experience of Ebola. And so this is something which will appear in our future report because we think it's worth discussing. And this is because it contradicts the finding about the weaknesses of institutions and Africa's health system. So it definitely is something to pay attention to. One of the learnings from Ebola is also the question of stigma. And indeed, we saw in various countries an effort to get populations to move away from stigmatizing people who were known to have suffered COVID. And it's believed that this learning about how dangerous stigmatization is for the spread of disease comes from the Ebola experience. So definitely there are some learnings from the Ebola experience, and also from, by the way, from other epidemics. So Zimbabwe had a cholera epidemic, and our colleague Simkai Chigudu has been drawing parallels between some of the government responses to the cholera epidemic and how the epidemic rolled out. So these are definitely some things that we will look at closely in our report.
Thank you very much, Tsotsi. There's one other question from Clement Damba, who says, I like it so much when you mentioned the concerns of COVID and the issue of community mobilization and so on. Oh, sorry, that was a comment. Yeah, okay, there is the question. But how will you say COVID has really challenged the culture of solidarity?
That's a very interesting and difficult question to think about. If I just reflect quickly on some of the experiences of COVID, lockdown, the rules against funerals and social gatherings, the implications of staying out of work and keeping away from people, social distancing and so on. Clearly, this was a very stressful and difficult time for many communities and societies. In fact, there was a time when people could not even bury their dead, particularly those who had died from COVID, because they were being buried by the states. And I can say that for countries that I know, this definitely stressed the bonds of solidarity and the ability to be there for people and also to pay attention to those who were mostly disadvantaged. At the same time, and the study on Niger and Mali show very clearly, this was also the period when people began to respond and look out for each other. And here we saw a lot of middle class solidarity for poor people. There were many civil society actors across Africa that were engaged in charity work in this period and gave of their time and sent food to communities and populations that were stressed out. And even the African private sector was very engaged in resource mobilization. So in a country like Ghana, they actually did the unprecedented thing of building a hospital for COVID sufferers and so on. So I think at one level, solidarity was stressed, but at another level, you could see that the bonds and the cultures of solidarity were galvanized to respond to COVID. So you see some of that in the findings of the studies we've been looking at.
Thank you, Tsotsi. One more question. What do the findings mean for the ability of Africa to fight future pandemics, especially on the challenges we have seen on coordination of regional response and administrative actions across countries?
I think the answer is actually in the question. I think we are looking at the fact that governments, and regional bodies and so on really have to begin to change the way Africa responds to crises that affect all of us. The question that one keeps on asking, for example, is that how come land borders are still closed in most African countries, but we've opened our borders to people from outside the continent? This is a good example of the lack of understanding or the lack of attention to the interconnectedness of most of our countries and the fact that our economies are heavily dependent on each other. So many people are saying that COVID-19 is a window and an opportunity to change the way we do things. But sadly, this window is not open all the time. And the signs are not good that we are thinking or learning about different ways of operating. We saw some bright spots in the fact that the Africa CDC seemed to have been quite active. Also, the COVAX system in which African countries have benefited from working together with others to ensure that populations can get vaccinated and so on. But I think it has to become deeper and more systematic. If we do not do that, I think our preparedness for a long COVID pandemic is definitely going to be, our lack of preparedness is definitely going to be exposed. And basically, our ability to respond to COVID in ways that do not destroy our economies will be severely compromised.
Thank you, Tsotsi. We have time for a few more questions, and there are quite some questions. The trust in the government by the population is important, especially to overcome vaccine hesitancy. Are there any inspiring examples to overcome this?
Jifa, maybe Jifa can also say something. Jifa,
please go ahead.
Do you have a reaction to any of these questions?
I think Prof has already highlighted the fact that the reports do not cover vaccinations. So what we say is not about the countries, but what the country report, but what we are also witnessing in our countries or following in the media. one of the things that we know is the fact that some countries in Africa, many countries in Africa already have been taking vaccines, especially when you are kids, you take. So there is that ground already for vaccines. So Ghana, for instance, has been labeled as a country that is vaccine friendly. So for the first week that our first vaccine started, there was a huge appreciation of it, and many people went for it. I think the second batch has also gone very fast. I'm not sure about the other countries, but it's been successful so far in Ghana. The first COVAX package that we have received has been successful. The issue is about getting more, because we only had, I think, about 600,000 doses that came in the first time, and the second time even less. So that's it about vaccines. If anybody else from your own country has some experience to share, I think that would be fun.
Thank you. Yeah, maybe that can be shared via the chat or Slido. Tsotsi, there's a question. Were there COVID experiences on gender and disability?
There was very little in our reports about disability, and that is a huge concern. And we've been reflecting on how we can actually come by this information. I think what it suggests is that countries do not collect information on disability. So I think that the one way of responding to this is to find what information already exists about the challenges that people with disability face with employment, with health issues, and so on. And basically look at the COVID measures to see in what ways they have addressed these. So far, we see very few countries in which any measure mentions people with disability. So this is a gap in knowledge about what COVID has meant. But insofar as we have seen that informal workers have been the most affected by the employment disruptions, we can assume that people with disability will have even more serious issues facing them at a time like this.
Thank you, Tsotsi. I think we have room for maybe 2, max 3 more questions. The next question is, what is your assessment on COVID's influence on small-scale farmers?
That is an important question, particularly in the light of the fact that many countries did not identify small-scale farmers as people who would be affected by COVID-19. If you look at the list of affected populations that countries identified, we do not see much about small-scale agriculture. In fact, some people were even claiming that the countryside did not suffer so much lockdown, so farmers were able to go about their business. But another study I've been involved in, which is looking at food security, has been raising some huge flags about the implications of urban lockdowns for farmers, and issues such as the cost of inputs, which went up severely, the disruption in food markets, which affected the ability of small farmers to access suppliers, challenges with traders and their loss of credit, and therefore what it meant for the ability to buy from smallholder farmers and so on. So it's really pointing to a huge crisis in the countryside that very soon our governments have to turn to and begin to pay attention to, because it's reflected in the food security crisis that many countries are facing. The volatility of food prices is huge. Many countries are reporting this, and day in, day out, food prices are going up. And this is in a context where people's incomes have been squeezed by COVID. So thank you for that question. I think this is an important area of concern.
Thank you. Final question, I think. there are stories that many more people have died of other diseases, illness, more than COVID claimed. How will you say COVID has affected health-seeking behavior in the studied countries?
Maybe I'll ask Jifa if she remembers some of the points about that.
Sure, go ahead, Sifa.
Okay. We have seen in the report the issues of medical programs, general medical programs for the populace and then affected population, counseling for certain groups of people, medical counseling for certain groups of people, particularly in Ethiopia and some other countries. Health-seeking behavior, the focus of the study doesn't cover this. It only tells us about what governments are doing the programs. We've seen a lot of innovations, for instance, in the medical field, medical service delivery, etc. So I will assume that it means there's uptake in those the innovations and the programs that are roll out in the countries, but we don't see much in the report about the behavior of the medical or medicine seeking behavior of the populace.
May I say something about that as well? Outside our 12 studies, I think we've been reading about the fact that people who were suffering chronic diseases had a period when they all avoided hospitals and so on because of the fear of catching COVID and the fact that hospitals were rather busy dealing with COVID cases. In the case of HIV/AIDS, I also read about some people whose medications, who lost regularity in their medications because there were shortages in the supply of HIV medication. But these are all, this is anecdotal evidence, and one needs to basically look more carefully at the evidence about the ways in which COVID would have affected health-seeking behavior.
Thank you very much, Dzotsi, for all these very insightful answers. And thank you all for the questions, very interesting. There are still many more questions, but I'm afraid we have run out of time and we are going to break into two groups. You can decide which group you would like to join. One group is on challenges for inclusivity, and we will have 3 country case studies that will present their findings. That is Nigeria, Mozambique, and Tunisia. And then we have another breakout room that will discuss innovations and solutions that came up in the studies. And here we will have presentations from Ethiopia, Kenya, Uganda, Ghana, and Rwanda. So the breakout groups are going to be formed now, and you can choose where you would like to go. Except, of course, for the researchers who will be assigned.
So please, if you do not know how to join the breakout session, let me know, or via chat where you would like to go. I can allocate you to the room.
Anika? Hello, Anika.
I think Annika is in the room. Which room would you like to go to?
Oh, to Mozambique, Nigeria, and Tunisia.
I don't know exactly which one that is. Is that challenges for inclusivity or innovations and solutions?
No. It's where we presented the findings of case studies.
I understand, but I don't have that list readily available in front of me currently. So I don't know. Let me check. Innovation, yes.
Yeah, we'll wait a few more seconds for everyone to come in. Okay, I think we can continue. So I hope you you all came back a little bit wiser than 20 minutes ago. We are going to continue the conversation with policymakers from the Netherlands and from Africa. And I would like to welcome our panel. Okay, thank you. I would like to welcome our panel members to have a short discussion and reflect on what they've heard in the breakout rooms and the presentation of Tsotsi. And I would like to extend a very warm welcome to Dr. Folake Ulatunje David, who is the director in the Educational Planning, Research and Development Department of the Federal Ministry of Education in Nigeria. Welcome. Dr. Gitinji Gitahi, he is Group CEO of AMREF Health Africa and member of the Kenyan COVID-19 Response Task Force that advises the National Response Team. And also welcome to Stijn Jansen. She is Senior Advisor to the Director General for International Cooperation at the Netherlands Ministry of Foreign Affairs. And welcome Paul Litjens, Head of Division Great Lakes Region and Southern Africa, also at the Ministry of Foreign Affairs. And lastly, and our moderator for this panel, Professor Dirk-Jan Koch. He is Chief Science Officer at the Netherlands Ministry of Foreign Affairs. Dirk-Jan, the floor is yours.
Yes, thank you. It's a pleasure to host this session. Dr. Altaf was asking whether we were a bit wiser than 20 minutes ago. I am definitely a bit wiser. I learned about about robot nurses in Rwanda. I was very impressed to hear about that. So very curious to learn more from our panelists today. We have two real doctors, not doctors like me who like to study, but doctors who actually cure people. So very glad to have them on board with us today. And I have two questions for all of our panelists, and it's going to be interactive. So don't hesitate to ask questions in the chat or for the panelists to interrupt each other. One is, what would be for you one of the main takeaways from either the discussions or the report, listening to the session of today, but also for your government, either for the Nigerian government or the Kenyan government or the Dutch government. What can we learn from all these very interesting researchers? So let me see, maybe I can start with Dr. Kitari from Kenya. How are you doing, and what are for you some of the takeaways?
Thank you very much, moderator. Your name is difficult, Dakjan or Coach? I think I'll just say Coach. And my name is also noticed as Gidenji Gitahi, and sometimes people call me Gigi. I've learned a lot. I've listened to some of the case studies. I've also looked at the research. For the last 1 year, I have sat in the National Task Force for COVID-19 response in Kenya, and currently also sitting in the National Vaccine Deployment Task Force, and also in the Africa CDC Task Force for COVID-19. And I think when I look at the research, it's very clear that what was happening in Kenya, in Malawi, in Ghana, in Rwanda, in Uganda is exactly the same. The challenges were exactly the same. That's the first thing. That the challenge is to exacerbating vulnerabilities through the responses were similar. Most of the government policies to cushion the vulnerable were similar with a few differences here and there. Most of the policies were similar. So this is the first lesson that I get from this multi-country study. The next thing is that in that similarity was blindness. There were blind spots on vulnerable groups. There were blind spots on gender. The closures across the countries and lockdowns were the same. Many of them did not pay attention to the fact that women needed to go and deliver despite curfew, that women need to go and deliver to access skilled delivery despite the fact that there were lockdowns. Secondly, I saw a lot of, even from the case studies, I saw a lot of responses actually being more directed to formal sector, almost like protecting enterprise rather than protecting communities. I see that across board. The other thing I see is that the knowledge on what needed to be done was uniform. But despite there being this uniform knowledge, there is a gap in institutionalization of that knowledge, so that the response seemed to be only temporary, rather than, and there were no examples of institutionalization of these responses for future. And therefore, it was almost like every wave came and started afresh. Every wave came with no learning from the previous one. I think what we can learn, if I look at the innovation that have been shared, none of these was actually adopted widely by government. Many of them were left to partners. I saw Kenya talking about wheels of life. I saw the private sector, big gain in Ghana, and I'm seeing comments complaining that the big success of the big hospital in the city was not replicated elsewhere. I see all these challenges. I see a challenge of lack of institutionalization of learnings. I think that's what I see. Finally, what I see is policy paralysis, that despite the fact that the policies were clear, governments were not quick to actually implement those policies. And therefore, whereas what was needed was known, implementation was a big challenge. And I think we've seen what that can result in when we watch the COVID pandemic in India. I think those are my quick reflections.
Thank you indeed. So from the blind spots to the lack of institutionalization to actually kind of paralysis of the policymakers, very useful points. I would like to turn our gaze now to Nigeria, to Dr. Folake. I hope you are there. Yes, there you are. I'm curious to hear your take on this.
Yeah, thank you so much. Jack, I think I've got that right.
All the names are allowed. We have Gigi, we have Folake. Yeah, the most important thing, we're talking about content here anyway, so names don't matter that much.
Hey everyone, nice to be here. Yeah, good work we are all doing, and good enough we are all addressing the same issue of ensuring that learners in school, that we continue with our life the way we used to before the pandemic, and even to be able to better the livelihoods of people in spite of the challenges that we face as human, be it in Nigeria, Ghana, Mozambique, or any part of Africa. The same trend is same. It goes to show from the studies I've listened to and gone through the fragility of our systems in tackling the issue of access and quality of learners in schools, to ensure that we have a system in place to ensure that all learners or even individuals are able to respond quickly to issues as they come. And particularly for in this case where we had the pandemic, it goes to show from the study that's been done in Nigeria that though we have policies in place, but then to be able to really, the framework for implementation, the framework for getting all hands on deck to attend to issues as they come is not so strong. We need to have we've had previous projects and activities going on, even that relates to ensuring that we have good learning environment. For instance, we have community participation and the rest of them. But then when issues come, are not able to respond quickly to mitigate the effects of the pandemic, for instance, be it in the education sector, the health sector, even the community level. We have cases, especially the vulnerable ones, being totally not properly taken care of when we had the challenges that we faced as a nation. And then, of course, the effect is not similar. The impact is not similar in all parts of the country. We have the rural areas that are even worse hit and not properly taken care of. We have the urban centers that quickly receive attention. And then in the area of even quality of learning, in our schools, we have the level of preparedness to be able to make learning go on in spite of the pandemic. The level of digitalization, okay, we use the traditional one, the radio, the TV. Yes, we had this, but then it still depends on a lot of other issues in the society. For instance, like power, like having access even to the to television, to radio, being able to come to access these things, and then even the children, that's the learners, being able to have sufficient information about not being attracted to support their families in finding some other means to sustain the livelihood. Because even when we had the lockdown, maybe in the other clients, they had provision to take care of the needs of the family. But this is not, it didn't flow too well in Nigeria and some other nations. So we have the need for us to have proper framework to implement policies. It has a lot of implication for us as policymakers to look at how we can make our system more resilient to issues as they come on. We don't have to wait until we have challenges or we have pandemic before we begin to make provision. We need to have to put in place resilient we have to have a way of making our systems resilient. Yeah. And the ability of our programs. Even when we have issues, like we have a lot of issues going on, insurgency, cases that need attention. So this issue of the pandemic even make the situation even worse in those areas. But then we need to continue to build on efforts being made by all partners, by government, by the private sector, so that we can have stronger systems to cope in case of challenges. Thank you very much. Thank you.
Yeah, thank you, Dr. Valaka. Very clear. So you say we need to have stronger framework, so the intervention to also become more resilient. And it's not always easy, you know, what you say in those areas where there's insurgency. Well, also even for the Dutch government, sometimes I see the problems in the Netherlands, even our country, it's stable, but still, as a government, we have big trouble sometimes in getting the right supplies, and the money is being squandered sometimes. So I can understand the challenges that you might face in such a huge country as Nigeria. I see some questions in the chat. Maybe you can already prepare for that. Because I will return to you. It's a question with respect to the role of the CDC in Nigeria and in West Africa. But before we turn to that question, I would like also to ask the Dutch policymakers, Paul Litjens or Stijn Jansen, to respond briefly. Who can I give the floor first? Yes, Stijn, go ahead.
Yeah, thank you very much, Dirk-Jan, and also the other panelists. Yeah, what were my main takeaways from the breakout session? Well, we've seen cases presented from 3 very different countries in Africa, I think Nigeria, Tunisia, and Mozambique, that were all very much influenced in the way that COVID measures were introduced by the pre-existing contexts that were quite different. So the main takeaway from that can only be that whatever happens needs not to be a one size fits all, but very country specific. And it's a bit of as we say, an open door. What else can I say about what this means for our policy? Is what you wanted to know, Dirk-Jan. So last year, when we responded to the COVID crisis, we immediately started thinking about building back better, building back forward, and inequality was one of the main areas that we took into account, and there we focused on localization, on cash transfers, but I'll gladly give the floor to Paul Litjens to talk about that, because he's one of our experts on youth, vaccine, equality, and digital inclusion. And that is something that I've really taken away also from for instance, the Nigerian case study, that digital exclusion was actually enhanced by, in principle, a very good program on distant learning that was introduced. What I've also taken away from the Mozambique case was, and something that I thought was very interesting, is that what was said is that the measures were very much influenced also by external actors and by what was happening in South Africa. And I think, as we were all basically amateurs on handling the COVID crisis, we were all influenced, all countries were influenced by what was happening elsewhere. But especially in Africa, that is something that I was keen on learning a bit more about. But I gladly hand over to Paul to talk about cash transfers.
I'll come to cash transfers later, but I would like to make three remarks of what I take from the sessions. One is, there's a lot of creativity going on in Africa in the response to a crisis within a crisis, as Dotsie rightly mentioned. So, and I think that that is the positive part, that we should stimulate that and allow that, and governments should allow that, because the creativity on the African continent is enormous. So whether it is on drones or use of robots in Rwanda, or whether it is making ventilators from local materials in in Kenya, or whether it is a local initiative in Ghana, which we call the 10 CDs, with the CEOs stimulating everybody to donate 10 CDs, for which that can be used to help the Kayayo campaign for street girls, or to construct an infectious disease center, or whether it is on working on local resource mobilization in mobility. It's that creativity that is the positive thing. That is, I would like to stress that is what one of my takeaways. The other thing that we learned is, and I was very much taken by what Dotsie said, it is the Africans, for them, it is a crisis within crisis very often. And they are the experts in dealing with crisis. We've had our own issues in Holland with, as Dirk-Jan mentioned, but they are clear with that. But there are issues to be taken very serious also. Dotsie made it very clear that it had the way governments responded, it had a very clear urban and formal economy bias in the COVID support. And that is something we have to take into account. If we could then come to, say, the cash transfer that I'm looking at more specifically, one of the things I learned having read some of these studies is that you can only support groups of people if they are able to organize themselves. I've seen studies like the motor drivers in Niger. They had their own union, so to speak, so they were able to voice their concerns, so they were heard and their voices were taken into account. Those groups of people that are not organized in one way or another, they are the most serious people to be taken into account in government measures. Very often governments would like to take measures, but they do not know how to make it inclusive. And I think that is what the Sipra Kuria from Kenya made. It said the challenge in Kenya was that the most vulnerable were left out, and the vulnerability even increased. That is something we have to learn, all of us, how to improve that. But given that, I'm not that negative about the way the governments have responded to the crisis within the crisis. They have done remarkably well, in my view. And I've been following many African countries over the last years in the way they have dealt with it. And there are some very positive examples and some very negative examples, Burundi, Tanzania as well. On the cash transfers,
yes,
I think
the last point, because then we move back to our other
yes. I have used this occasion to stimulate the use of the debate within my government on the use of social protection, and in particular on cash transfers. I think the COVID response by many governments have seen the very good examples of it, and also the examples where we say, well, maybe that is not the way to do it. You do not need to, for instance, delay payments for electricity or water bills, because that is a way for a cash transfer, because those are the people who already have electricity or water. So you need to target better the type of the cash transfers that's required. But hopefully next week we will be able to talk about it more. Thank you.
Thank you, Paul. I would like to give our two doctors, Dr. Gigi first, the floor to reflect a bit more, and then we'll move to Nigeria, and then we'll try to close. Gigi.
Thank you very much. I think as we know these challenges, I think what has been on my mind is how to build how to build forward, how to bounce forward, and what is it governments can learn and change policies in order to avoid similar exacerbation of vulnerabilities in future. And I think what Paul has talked about in terms of organizing groups, organizing communities is critical, because then they bring their voice. And what we found is that, as he says, where people are organized, they were called to the table. The task forces were inclusive, but where they were not organized, they were not members of the task forces. The next thing is the role of the health of building the health system, because we found that ultimately every response that created this exacerbation of vulnerabilities had to do largely with the health system. And we saw that whenever the lockdowns, even now, they're preceding filled up hospitals, low levels of oxygen. That's what precedes the lockdowns. So ultimately, I think, as a policy learning, that if we can build the health system and build some redundancy in it, which then absorbs its resilience, then that will be a major thing to learn moving forward, so that we can reduce the need for lockdowns and therefore increase the health system responsiveness, saving lives and saving livelihoods. I think that will be a key takeaway. And in this rebuilding, we have to be ready to absorb innovation and make sure that innovation is institutionalized, is not just done during this peak, but is institutionalized in the building back better. Thank you.
Thank you. Okay, that's a nice plea for indeed more innovation and institutionalizing it. Thanks, Gigi. Dr. Folake, there was one question for you on the role of the CDC. Did it help or did it hinder in Nigeria? Can you expand a bit on that and also provide some last remarks from your end? Could you please unmute yourself?
Thank you. Yeah, thank you. So we call it the NCDC in Nigeria. Of course, at the outbreak of the pandemic, the NCDC was set up, and it's been effective providing direction to support that came in to mitigate the effect of the pandemic. So to that extent, and then resources were, since it wasn't a budgeted activity, but supplementary budgetary allocation was made, And even the private sector also supported to finance the activities that's emanated from the things that needed to be done. So of course, the CDC is still in action, and even till now, made up of different subsectors of the sectors of the economy, health, education, security, and the rest of them. And it's been up and doing in ensuring that we have the pandemic properly checked and that people are able to live as normal as possible. And of course, on our part, that has been done and is still ongoing in Nigeria. So I think that is what we are doing with this NCDC in Nigeria. Yeah, thank you.
Well, thank you. And, you know, for me as a relative outsider, I'm just so impressed with all the research that was done over the last year by with the support of the Include program. You know, my mother always tells me, you know, that a crisis is a chance. And I think this research has shown that in the midst of a big crisis, you were all able to set up this this impressive research program with 12 research teams from the continent. I think for me, this is really an example of how to move forward with our research collaboration in the 21st century. I personally had learned a lot from all the reports today, things that I wouldn't have learned if it would have just been English or Dutch researchers doing their research. This would not have been possible without this bottom-up approach. So thank you everybody for making that possible. Maybe one closing remark from my end, and that's of course, we have been zooming in on the national responses and how they could have been improved from the equity perspective. But I think that we shouldn't overlook actually the international dimension as well. You know, the interlinkages between the African continent and the rest of the world, especially next year, the negotiations will take place of the Global Pandemic Treaty, Pandemic Preparedness Treaty. And it can move very swiftly. We saw that after the Chernobyl nuclear disaster, within 1 year after Chernobyl, there was the nuclear incidents international treaty. And I think it's very important that if we talk about getting all voices heard, that African nations are prepared for these negotiations, which will take place and might end before you know it. So this is very important for the long-term response and to prepare Africa and African continent well for the next crisis. So the Global Pandemic Treaty is something to watch. And of course, the other big issue, and some of you referred already to it, is the vaccine issue. I think, to be honest, many Western countries have misbehaved in this respect, to be honest. And first of all, of course, we had the big discussions on the patents, and relaxing the patents wouldn't help. Well, that might be very well be true, but we need to do everything we can to ramp up this production with production support, with relaxing the export controls on certain of the ingredients that are needed for the vaccines. And I think more research on that is needed to make sure that Africa will be at the same levels as vaccination as Europe or America. Well, I count on all of you, since I've seen how excellent research you have been doing, that you will also study those international dimensions, because I think they are critical moving forward in dealing with this crisis and coming to equitable responses. So thank you to all of the research teams, but also a big thank you to the Include platform. I think it was truly remarkable what you have been doing over the last 12 months. And I think I speak on behalf of many of my colleagues at the Ministry of Foreign Affairs. Keep it coming over the coming period, and we'll be with you in this journey. Any questions that haven't been answered have been noted down, and we'll try to make sure that the Include people will respond to them as possible, if that's still possible. Thanks to all the moderators, and let's keep in touch.
Thank you very much, Dirk-Jan. And once again, also from Include, a very, very big thank you to Tsotsi, to our panel members from the ministry, and especially Dr. Gitinji and Dr. Falaki. Very, very big thank to you that you joined our conversation. And I would like to let you know that we have another session tomorrow on youth employment. It's called Merging Perspectives on Decent Employment for Africa's Youth Post-Pandemic. And you can join either by registering or the live stream. It's from 2 to 3:30 Central European Time. Thank you very much, everyone, and have a lovely afternoon.
Thank you. Bye.
Bye. Bye, Falaki.
Yeah.
Thank you very much.
Thank you. Bye.
Bye, Supra.